Hi, I'm Dr. Emerick, and today we're going to talk about RPEs or Rapid Palatal Expanders. Expanders are important, especially at an early age, to correct skeletal discrepancies such as crossbites. If a patient has a tongue or musculoskeletal habit, thumb sucking, it can change the way they're growing essentially. And this is important to address at an early age, and this is why we like to see kids at the age of 7, because if you allow them to continue this growth, they can develop an asymmetry, a facial asymmetry, and it will continue throughout adulthood. It's irreversible unless they undergo some type of orthodontic surgery later on in life. At the initial consultation, I also do an airway assessment, and if I see that the patient has symptoms of an airway issue, I may also recommend an expander because the roof of the mouth is the floor of the nose. And so we are increasing this area, we are increasing the nasal airway, and the patient can become more of a nasal breather as opposed to a mouth breather. And this can solve all kinds of problems. It's important to breathe through your nose and not your mouth. And so we have patients that we will recommend either an upper expander only or upper and lower expander. And I may even refer you to a myofunctional therapist to retrain the tongue and to assess any tongue ties. This is all important because we want to get you to a healthy breathing, and expanders really help us to do this, especially at a young age. So these are the expanders I like to use. It's a mini expander with 3D printed bands, so separators are not necessary. It's nice and small. You take the key and you place it into this little hole right there. Do a gentle turn towards the back of the throat, pull straight down, and you've completed one successful turn of the expander. You should never feel pain while you're expanding. You should just feel light pressure. It's normal to feel slight discomfort and slight pressure around the nose and in the mouth, maybe even on the teeth, but you should never feel pain. If you feel pain, you need to call our office and let us know. Gradually, with each progressive turn, it's going to widen the upper jaw and remodel the dental alveolar arch. If you still have questions about expanders, call our office. We're here to help, and we're happy to see you for a complimentary consultation. Thanks.